we've received a lot of questions already about cancer-induced peripheral neuropathy. So that is our topic for today. Before we really jump in with Rita, first, I want to give a big thanks to our digital education events, because we know that without their support, that we could not continue to bring topics and discussions that are important to our Unite for Her members. So I want to give a big thanks to our presenting sponsor, West Pharmaceutical, as well as additional support from Daiichi Sankyo, Lilly, Merck, and GSK. So for those that may not be able to join us today, please know that we will be recording this through our Facebook page, and it will be live on our Her Library as soon as later today. So if you're not able to join us or you'd like to share this discussion with someone else, know that you can access it through our Her Library. And then before we jump in, I'd like to give a little teaser. So like I said, our discussion today is based off of a speaker series that we presented with Rita from ReVital Cancer Rehab in October 2022. So that recording is already available in our Her Library. You can go to uniteforher.org/herlibrary to view that recording. In addition, we've got a lot of things jam-packed for September. So beginning September 15th, it is Hispanic Heritage Month. And so we'll be kicking off that celebration and recognition with our virtual hangout on the 13th with my colleague and culinary dietitian, Catherine Romero. So she will be whipping up some cultural cuisines in my kitchen and teaching us a little bit more about the culture. So definitely be sure that you join us for our virtual hangout. And then in addition, we're doing a lot for Ovarian Cancer Awareness Month. So our speaker series on the 14th, we will be joined by two physicians in the Gyn-Onc community that will be talking about advances in ovarian cancer, including both immunotherapy and discussions beyond BRCA. So that will be Thursday, September 14th, 6 p.m. Eastern Time, and our virtual hangout will be September 13th at 5 p.m. Eastern Time. So be sure to join us for that, as well as all of the rest of activities we have planned for September. So with that being said, I really want to jump in for our topic today. So please let me introduce our expert, Rita Padhiar. So Rita is part of the ReVital Cancer Rehab program. She is the director for the Southeastern PA location, and she is a certified cancer specialist. She is well-versed in manual therapy, techniques including SI joint, lumbar, soft tissue, neural mobilization, and cupping techniques. She's also undergone advanced training and is considered a concussion expert and is a market champion for the recovery and reconditioning program widely used to treat post-COVID patients. So lots of different expertise Rita is bringing to us today. So please join me as I welcome our special guest, Rita Padhiar. Rita, thank you so much for bearing with me and being with us today again.
Thank you so much, Erin, for having me, and it's a pleasure to be here. I really enjoy these interactive sessions, and I'm hoping that I can help at least change, the face of peripheral neuropathy a little bit, and in the process, regain the patient's quality of life, getting them back to what they really love to do. And I really apologize. I'm taking it from the car, but I was having technical difficulties too. So I just decided to take it from the phone.
That's okay. We've clearly all been there. We just appreciate your time with us today. And I know that we have been flooded with questions from our members. So we will get through as many as we can and hopefully address all of them that we've seen come through up until now. So I think a great place to start is really just telling our members what is peripheral neuropathy. And I know we had a question from our audience, why does this happen during her chemo treatment? One of our members said it was her left foot in particular that was her biggest problem. So share with us a little bit about what it is.
Yeah, the technical term is CIPN. So CIPN is actually chemo-induced peripheral neuropathy, which means some of the drugs, the chemotherapy drugs, damage nerve root endings, and nerves are what send impulses to our, to different parts of our body. And peripheral neuropathy is they actually damage the nerve roots for the feet and the hand. So in the distant, not in the central system, but in the distant system. Definitely, because chemo is responsible for damaging these nerve root endings. That is why like patients present a lot of times during chemo treatments and a few months after. A lot of times, I have seen that after the chemo treatments have stopped, the peripheral neuropathy does seem to start resolving, but that doesn't mean that that is true for all the patients. Some of the patients, there is permanent nerve damage, and that can continue for years even.
Oh, okay. And so how particularly does this present? How would someone know that what they are experiencing may in fact be CIPN?
Yeah, so some of the symptoms which we have commonly heard in the clinic is like numbness, tingling, prickly kind of sensation. Now remember, the nerves are like responsible for muscle contraction. So you can present muscular problems like muscle cramps, weakness. And that in turn, some patients might feel like, oh, you know what, I'm beginning to lose my balance. So it might present with that. A lot of times it will start affecting their function. So they're not able to fasten, for example, like do things which their fingers, which they previously could, fine motor skills, buttoning up their shirts. So it could present in a varied way across anything which involves nerves. That's where you're going to see it.
Okay. So someone could see any or all of those symptoms. Is that correct? They don't have to necessarily have everything.
No, they don't have to have everything. It presents very varied. And actually, maybe some of them might see all of them, and some of them might just say, okay, you know what, I'm just feeling the numbness.
Okay.
Which is common, like I heard a lot of that.
Yeah, and we had one question that came in. Someone asked, could it possibly present as tendinitis? So could that be actually CIPN?
Absolutely. The tendinitis, if it is just classic tendinitis, doesn't necessarily have to be CIPN. So I want to clear that. Now, does CIPN come along with tendinitis? Yes, that is 101% possible. So remember, the reason why they get CIPN is due to nerve damage. The nerves are responsible for firing impulses to the muscles, to the tendons, and that is why we are able to move. So when that whole pathway is disrupted, that is when you start finding that, yeah, you know what, like I'm beginning to feel pain in this particular tendon, or my tendon is probably not firing optimally. So when I do repetitive activities, I'm beginning to start experiencing that tendon pain. So yes, they are correlated.
Got it. That's a wonderful description. Thank you. So, as an expert in the physical therapy world, can you talk a little bit about how PT and occupational therapy, OT, could help manage this, and perhaps even discuss how it could be good for not only those pain symptoms, but even that numbness that we've heard so much from our members?
Yeah, so I want to let's address the pain first. So the tingling or prickly sensation and cramping, all of this PTs are experts in. PTs are experts in anything musculoskeletal, and that means the muscles, the nerves, the tendons, and we are able to treat each one of these individually. So now, according to the research, like if I present the research end of it, there is moderate evidence out there that exercise helps CIPN. There is nothing out there other than medication, which we'll hit on later. And that too, it's a maybe, which has high level evidence. Moderate evidence in the world of PT or in the world of CIPN is considered very good. So the way PT can help is increase blood circulation. Some of the way we can do that is by aerobic exercise, and which I really want to hit on because that is something everyone can start immediately.
Yeah.
The number one evidence, honestly, more than even stretching and strengthening, which I'll hit on next, is aerobic exercise. Why? Aerobic exercise brings in blood flow to every single part of your body. And the more there is blood, the more the toxins, you can get rid of toxins and get that replenished with healthy nutrients. So aerobic exercise would be my first recommendation. Second, we talked about how CIPN can present as cramping. The best way to get rid of cramping would be stretches. So just having regular stretching regimen, for your hands and feet particularly, but also for the whole arm and the leg, that can be a second thing, which is very easy to implement. I usually say twice a day, and morning, evening, or whenever the cramping starts even. The third thing I would recommend is strengthening, because of the neural impulses being reduced or damaged, you don't get as much. It translates into weakness. When this translates into weakness, not only the muscles which are affected, but everything around them starts getting affected. So having a good strengthening program, especially strengthening of the intrinsics, which is the foot muscles and the hand muscles, is the best way to go. And the last thing is doing something known as neural glides. Now, sometimes, like we just discussed, because of inflammation, the nerves might be getting trapped along the way. So neural glides is like flossing. So like supposing you have a floss which is stuck in your tooth and you just kind of tug it back and forth and it unloosens itself. That's kind of what a neural glide is. So that would be the third. Now, all of this combined can translate into balance deficits. So the patients are not able to walk, and that can result in a fall. So the last thing we do is to kind of bring it all together is activate balance activities.
Wow, such a multifaceted approach to this sort of thing, but good to know that there are lots of things that even a person could start doing at home. Now, we did have one question. You mentioned that aerobic activity, which I'm glad that was the first thing that you mentioned.
Right.
One of our questions came in and she said it was recommended that she start walking, but this person found that the walking may have made their CIPN worse. Could that be the case, or is that just maybe part of the initial process?
No, that could be absolutely a case. So what happens a lot of times is like there is a lot of cramping and numbness. And when you are not, multiple facts. So when you are putting more strain on those muscles while walking, it can absolutely make it worse. I would switch to a stationary bike in that case, because at that point your feet are supported, or one of those recombinant stepper kind of thing where you can have absolute supported feet. That would really help, because the second thing which really helps CIPN is sensory integration. The more information they can get from their environment, the better they feel. So that stationary bike would really help, because it will have full support, and you are not in trouble of losing your balance either. The second thing with walking would be try using a very supportive shoe with a good orthotic in it. Because if you have a shoe which you are using, which does not provide these elements, the feet do not get that sensory integration, which I'm talking about, and the cramping can get worse.
Okay. And I know that we'll talk about footwear and orthotics again in a little bit. Some questions just about the PTOT aspect of it. Do those same exercises that you pointed out, the stretching, the aerobics, the strengthening, the flossing sort of activities, does that also help with the numbness that a person may feel as well? Does that apply for both sort of complaints that we tend to hear from our community?
So I'm glad you brought that up, because I did not address that. The numbness is more difficult to get rid of. I will be honest with you, like as soon as you start feeling like tingling and cramping and all of those sensations, get yourself to someone who's an expert on this. Once you reach the numbness part, or maybe that's all you have, it is slightly more tricky, because that could indicate that the nerves, peripheral nerves, are more damaged than we like. Now, remember, these nerves do regrow. Peripheral nerves do regrow. So they regrow 1 millimeter per week. So
I'm glad you mentioned that. Yeah, that really slow growth. Can you read that number again? Say that number again.
1 millimeter per week. Yeah. So it is going to go really, really slow, the regrowth. And you might find that initially this numbness is there, and then over time, you will find that the numbness seems to disappear, and that is because of the regrowth. While that regrowth is happening, there are a couple of things you can do is like really try to watch your balance, because if you don't get that feedback from the environment, you are more succumb to falls. So
Right.
switch to very supportive shoes with good orthotics to give that, feet some support. In addition to that, sometimes going to a PT and getting those neural glides, which I talked about, might help because something is getting stuck and maybe that's why the numbness is coming. Sometimes the numbness can even come from low back, which is unrelated, maybe even to
Mhm.
CIPN, because in the
Mhm.
process of all these treatments, you develop joint pains, and it's like you're treating the whole body, really. Because I have found
Okay.
that happen. I had a patient who came in and the numbness was not as a result of CIPN at all. So
Wow.
I would really get to a clinician who can make a thorough assessment of where exactly this numbness is coming and then address it accordingly.
Okay. And can you expand a little bit? I'm just curious, the neurogliding, is that like a machine? Is that a set of exercises? What is that when you mention that?
It is absolutely a set of exercises. So it is so
Got it.
easy to do. And unfortunately, I can't demonstrate over here right now. But
Yeah.
basically, like if it's for the foot, then we can do sciatic nerve glides. And if it is for the arm, like an OT would, or even a PT can teach like median nerve glide, ulnar nerve glide, radial nerve
Got it.
glides. So it is totally doable. Again, with these glides come a caution. If it is making it worse, do not do.
Okay.
One thing I would like to honestly say this for every single thing: nerves are sensitive. So if you annoy them and you make them angry, you are not going to be able to calm them. So anytime you reach a point, like you mentioned, the walking, right? Back
Mhm.
off, try another activity. Do not force yourself to do something and annoy them further, because it's going to get more difficult to calm them down.
Yeah, that's a really good reminder because I think sometimes we might feel like we have to push through the pain or
Mm-hmm.
push through the
No.
discomfort. But like you said, nerves are sensitive, and if they're angry, then we can't get them to heal. So
Mm-mm.
that's a really good point that you brought up. And I'm glad you even gave the suggestion of, switching to a recumbent bike or a
Mm-hmm.
stationary bike instead of walking. So I think that's really helpful. One of our members had mentioned a characteristic. She said her ankles were feeling rigid. Is that sort of also similar to the tendonitis question, like a trickle down sort of side effect that she may be feeling as a result of the pain, or could that be something totally different?
So usually CIPN does not present as any rigidness in the ankle itself. But remember,
Okay.
the consequences are like as a result of CIPN or decreased mobility maybe. A lot of times when you're having that nerve cramping, feeling pain, numbness, so be, you are reluctant to move your foot. If you don't do these stretches on a regular basis, or you don't start moving, that translates into rigidity of the ankle. So
Got
yes,
it.
it's a trickle down effect. It is not classic CIPN, to answer your question. One of the things, that's why I always say to all my patients, motion is lotion. But that doesn't mean like movement without like not just like, I want to kind of clarify that in the case of CIPN. Like you just don't
Yeah.
want to do random movements. It should be controlled movements, which really seem to help CIPN and which would also in turn help with the stiffness.
Got it. Oh, that's I'm glad you clarified, but I'm glad you also reiterated the importance of movement, but also why it's really important to seek a professional, especially,
Yeah.
starting off, because like you said, you don't just want to do random movements, things like the neurogliding, you want to do with someone that knows what they're doing. So I'm glad you mentioned that. Now, actually, a lot of questions that we came in varying forms was around the question of, can CIPN be cured with PTOT? Will it ever go away? Can you speak a little bit to the improvements and the degree of healing a person may experience?
Yeah, absolutely. So again, CIPN can be something some patients are, it's just a temporary phase anyways. once the chemo treatment stops and maybe a few months after, they begin to see that it is self-resolving. So where PT would come in is like we would help manage those few months with what I already described, with the treatments. Now, for the patients, like, can we completely get rid of it? If it is minimal CIPN, I can say that I have seen a lot of patients with just doing these things have had like complete 100% success rate. Yeah, but then if it develops to like it's a consistent thing, and this has been going on for years, and it's a chronic thing, it becomes a management strategy. Again, a moderate evidence is out there saying exercise, which is actually my prescription and my primary prescription, helps with CIPN. So moderately, we can get rid of it for the severe cases. For the mild cases, maybe completely. But we can definitely help manage it. That is across the board.
Help management. And I think we all need to hear that hope that there is some light for improvement. Now, speaking of management, can you talk a little bit about how CIPN could affect a person's function? So some of the things that may be affected that one of our members may not realize may be impacted as a result of these symptoms.
Absolutely. One of the primary CIPN is, of course, common more in the hands and feet. So that is our contact with the environment, really. My biggest, I have seen, maybe because that's also because I'm a PT, I have seen that the patient will come into the clinic, I have been falling a lot and my balance is off. That is how it all starts off. And then when I dig deeper into this, we are beginning to find that, well, yeah, I'm having this pins and needles and my sensation is altered. And, I have noticed that like anytime I can feel my feet and I'm going up and down the stairs and I seem to be stumbling a lot. So that's how it presents a lot in the feet. As far as the hands, as I said, it's mostly fine motor skills. Like, no, I don't know whether anybody really ever does that, but putting a thread in the needle, I can't do that because I can't grip that thread or I can't grip that needle. Or I'm beginning to have trouble cutting or putting on, my shirt button, for instance. So that's how it functionally presents. And there can be a list of other things too, which I'm missing.
Yeah, but it's all those things that we do with our hands. And I know, and our team, when we connect with our members, we're always asking, especially if they've made mention of some degree of CIPN, how are you getting around the kitchen? How are you doing preparing? How's your cutting? Are you able to lift and move things? Are you dropping things?
Yes.
So I think that for us is what we notice a lot, how CIPN can affect them because of those fine motor skills that we have to use in the kitchen when we're putting meals and snacks together for ourselves. So it's good to sort of generate that awareness that, our members, if you're experiencing that, might want to be a little bit more aware.
Correct.
Okay, wonderful.
I also want to bring, as far you mentioned being more aware. Now, remember the sensation is altered. So you want to also be aware of more extreme temperatures like hot and cold, fires, sharp objects. So that would be something like start and falls. So I would like check my environment while I'm having these symptoms and make sure that I'm not putting myself at risk.
Yeah. Would you recommend, I know this is something that we might recommend for someone that might be having some diabetic neuropathy, but doing those hands and feet checks every day, especially if something like their feet is affected and they're not always looking at the bottom of their feet. So let's do a check. Like you said, some of those temperature or pain sensations might be affected as a result. So is that something that you might recommend? Hey, you just want to like give a visual once a day?
Yeah, absolutely. Especially with the numbness, because that's when you can't feel anything and you want to check for any cuts, bruises, blisters, what may be. And so there is a two-part theory to this whole CIPN. And I'm sorry if I make things a little bit complicated. But so one of the things which seems to help CIPN is also barefoot, right? So when you are walking in a safe environment, barefoot, you get more sensory feedback. I'm talking safe environment. I want to underline that in red, right?
Mm-hmm.
Like, so for instance, like I know that my grass is pretty clear. I don't have anything there, any pebbles. It is a very well manicured grass. And I have sent my husband or whoever has good sensation on it, and there has been nothing. Then that would be great because it ends up doing what we call sensory reintegration, getting used to different textures. And for that, a barefoot walk might be good. But when you are going in an unsafe environment where you're not sure what you're going to find, my strongest advice is good quality sneakers with orthotic if needed, because if they're not providing support to those feet, that's the way to go. Same inside the house, right? Like if you're going barefoot, be careful that your environment is clear of anything which would give you cuts and bruises. But at the same time, do I say barefoot is always not good? I would say be careful. In a weird way, it could be good, but then you have to be very, very cautious because your feet are not getting that support, and that in turn could result in balance dysfunction.
Right. Okay. So let's jump a little bit more. We had some questions about footwear, orthotics. So let's specify a little bit about orthotics in particular. Is this the type of orthotic that, we could buy at the store or at the pharmacy, or might you recommend seeing a podiatrist, getting fitted for orthotics, if this is something that a person thinks they may be dealing with for the long term?
Yeah. So it's not a bad idea anyway to have good foot, right? Like that's just generally your foot health. Now you are thinking like these muscles are not functioning at their optimal. So the best way, and also there is too much feedback or too little feedback. That is what CIPN. It can present as too much feedback when there's pain, cramping, all of that going on, or there is very little feedback. Either of the two, what they really like is support. I would say, I know that if you go to really get a custom made orthotic, the cost is like 400, 450, and this is at the minimum. My first advice would be maybe get yourself to a physical therapist. Even we can assess for it. And it might be a lot cheaper than going to somebody who specializes in orthotics. Not saying that not to do. If you have access to that, that would be the best. So I want to throw it out there. If you don't have access to that, go to a PT and get them assessed for your footwear. And they can suggest you the right kind of orthotics based on your foot posture.
Love that. Yeah, because we know definitely the financial impact of that. Not everyone has access to those kind of dollars, especially now. So I'm glad that you made that mention that there's always an alternative. We had one of our members ask a question about cold gloves or socks during chemotherapy. Does that help in preventing or minimize neuropathy? So speaking of footwear, do you have any knowledge or opinion on if that could potentially help?
Actually, there is a lot of research coming out in that direction. And the so when you want to protect the nerve endings, and chemo attacks the peripheral nerves, which is the nerves of the hand and feet. So when you have cold, those nerves can be preserved. And also, with the hair loss, right? Chemo affects hair loss. So a lot of the, you are beginning to see that the oncologist or the person administering the chemo has cold caps and gloves and mittens. I would not say that's a bad idea. The research is pretty positive on that. There is no like high evidence, but it is not low evidence either. So definitely have that discussion with your oncologist and see if they can administer that. But the result is good. Yes.
I love that. I love that you said there's really good science coming out behind that, because I think someone can do, like you said, to preserve those nerves is worth the discussion for sure. Correct. So I'm glad. Okay, let's talk a little bit about how a person could manage at home or how they could get started. So do you have any particular advice on where to start in terms of things a person could do? You mentioned stretching, you mentioned aerobic activity. Is there massaging or any particular that you could share? Hey, you're probably not going to be able to get in with a PT today, but you could do these things at night or in the morning.
Absolutely. So I actually did not this time mention, which I did mention on my first talk, was massage. A massage is, again, with these, it presents a lot as muscle cramping. And the best thing for muscle cramping is stretching and massage. So what I say, over the counter, if you can get on Amazon, and they have foot rollers all over the place. And really the price can be also varied. Preferably a foot roller. All foot rollers do have what do you call uneven texture. And the reason that seems to really work, it kind of massages out any tender points or trigger points from the feet. So I would say that the first thing you can start off doing would be getting yourself a foot roller of any kind, or someone else to massage it for you. That would be good. And just doing, like, making sure that when you are seated, your feet are not dangling. So again, the more feedback you get from the environment, the better. So especially while you're seated, get barefooted and make sure your foot is completely flat against the floor. And you can do some finger spreading back and forth. Again, that can be like helping with the muscle cramps, and also is a mild form of neural glides too. Basically trying different textures to rubbing your feet with different textures for sensory integration. All of this should be done with a word of caution. If everything is getting worse with what I suggested, please halt, and I would take the expert of a specialist at that point.
Yeah, those are really great advice. And I know one of our members had said she had found some online guidance or exercises. Is that worthwhile? Is that pretty safe? I guess if it comes from a reputable source, a national organization or association, that that person could potentially tap into starting off with some of those movements.
Absolutely. Yes, I think that would be absolutely safe. Now, every person presents differently. The one thing about nerves, and this is commonly seen, I have commonly seen in my practice too, that there is not one formula which fits everyone. So the approaches are so varied. I would try that out, but I would immediately stop if it's making it worse.
Okay.
Yeah.
Okay. Yeah, that's and then of course seek the counseling, the guidance of a professional for sure. Okay, we have a couple more minutes left, so I just want to sort of wrap up with other things, and we had a lot of other questions that came in about topics outside of PTOT, which I know is not your specialty, but are you able to speak on perhaps some of the common medications? Or we've been asked, is vitamin B helpful for CIPN? Are you able to speak to any of that?
Yeah, absolutely. So I made a list of some of the medications and which I've seen, and I can tell you what I have seen commonly seems to work on patient experience and on my research itself. So the first one I have on the list is amitriptyline. It is used also for the treatment of headache and depression. I have not seen that very common when I'm looking through the medications for my patients. So I feel like it's going out, but it used to be there. The one which I feel has high evidence, which I did mention earlier, was duloxetine. And that is also used in the treatment for bladder problems and depression. Compared to the evidence out there for CIPN, this is probably one of the highest. Again, I am not, this question definitely goes to your oncologist. So all I can say on that would be have the discussion that, this medication exists and what are their thoughts, and they can give a better, kind of like whether that is for you or it is not. Gabapentin has been used across the board. The most common, like almost 80% of my patients have tried it. Again, hit and miss. I can't say it works for everybody, but that would be a question for the doctor. And steroids for short term, because there is inflammation associated with this. Like we talked even about tendinitis. So steroids are good for tendinitis. Steroids come with their own set of side effects. So with a word of caution, of course.
And short term,
patches or creams, over the counter, some patients have used that too. I always tell my patients this: if it seems to help you, and if your doctor is okay with it, go for it. As far as me, this is kind of out of my scope again. So Same with vitamins. Like I would have that discussion with a nutritionist or your doctor. That is kind of out of my scope. But I do want to touch on, I don't know whether we have time, but there are other treatments out there which have gotten very popular in recent times. And acupuncture is one of them.
Love that.
Yes.
Love that.
So definitely reach out to, and think of that as an option. It does stand very much on the research end at par with exercise, moderate amount of research for acupuncture. The other thing which is gaining a lot of popularity is biofeedback. So biofeedback is actually administered a lot of times by psychologists even. Basically, it is telling your brain to calm down. And they use visual aids to kind of assist you with it. So those are the two which I myself am looking into, reading more articles about and seeing the current trends. I want to also hit on one more thing. There is something known as electrical stimulation. So electrical stimulation is like, again, kind of calming the nervous system. The research, I am particularly very much interested because we do electrical stimulation as PTs for pain relief. And I know that it works temporarily for that, but there is no long-term effect of that either. So as more research comes out, we will know more on all of these current trends, but that's where the research is going.
Yeah. And so what I'm sort of gathering from all of this is, the management of CIPN is really multifaceted. So there's a place for potential medications with it, which is worth a discussion with your physician. There is space for physical therapy, balance, strengthening, neural gliding, those sort of specialized things. There could be a place for, something like B vitamins and giving that a try and speaking with perhaps one of our dietitians on our team, the acupuncture, the massage. So it really seems that there's, like I said, multifaceted approach to hopefully get the best result for anyone that may be experiencing this. Would you agree?
I totally agree. And I also feel like we should throw it out there, and you and me had that discussion. Make sure if you're seeking one of these treatments, they specialize in CIPN. Because I know I have come from both worlds. Originally, for the most of my career, the first 15 years or so were totally orthopedic related. And I would not have given you all this advice, and I would not be the expert. I'm sitting here in this hot seat today. So when you seek a PT, especially I can speak on that end, make sure you look for a PT who specializes in oncology. That's what you're looking for. Our program is known as ReVital Cancer Rehab. And I know Erin is going to put it on the chat for where these locations exist. But you might be in a state where we don't have ReVital or anything like that. Then I would make that phone call and say, do you guys special at the least in neural techniques? So underline anything to do, like, are you specialized in treating neurological conditions and neural techniques, not just pure orthopedics?
Got it. Okay. Yeah. And so I'm glad you mentioned that. So of course, ReVital Cancer Rehab is a national program. Their website, we'll pop that on the chat. We'll make sure that's available in her library, ReVitalCancerRehab.com. So you're welcome to see if there is a location in your area. But I think you gave some great advice. If someone, has a PT program in their area, perhaps they're already working with someone and there might be that neural specialist in their practice. So I'm glad that you gave those questions to ask. So someone make sure they get the best professional for them.
Yeah. And last but not the least, you can always shoot me an email, because I am here to help you guys, whether you come through ReVital or anybody else. I have actually personally sat down with the patient, discuss their needs, and then try to find the best location for you guys. And I have a lot of resources all around the country. So I want you guys to get the best possible care. And Erin, I think we should mention this, that physical therapy for CIPN is paid by insurance. It is paid. So patients, don't bring it up with your oncologist. A lot of times they are not aware how much of a difference the physical therapist can make. So bring it up and assure them that this is paid through the insurance.
Absolutely. I'm so glad you mentioned that because we know cancer toxicity, financial toxicity is a thing. So anything that we can get insurance to support, 2 thumbs up for, absolutely. So be that advocate for themselves. Wonderful. Oh, Rita, amazing, as always. Thank you so much for spending
You're welcome.
your afternoon with us, even from your car. We appreciate sharing all of that knowledge and tips. You're the best. Thank you so much.
Well, thank you. It was a pleasure. And shoot me an email if any more questions or any more suggestions.
Yep. So we'll be sure to share the cancerrevitalrehab.com website. With this recording, we'll share Rita's email as well. So you're welcome to reach out to her individually with any of your questions. As always, this recording will be in her library. So if you want to go back and re-listen to anything that Rita shared, you're welcome to do that as well. I do encourage you to also check out our speaker series from October 2022, where Rita dove a little bit more into cancer-induced peripheral neuropathy, CIPN, and you can give that a watch as well. So with that, I want to give a big thanks for joining us for our Ask the Experts. Thanks for our patience with our fun technical difficulties today. I want to wrap by thanking our sponsors, again, West Pharmaceutical, presenting sponsor, for just being a huge support in sharing our education series, as well as additional support from Daiichi Sankyo, Lilly, Merck, and GSK. Stay tuned for more events throughout September. We've got so many great things coming your way. Hopefully we will see you then, but otherwise, enjoy these last couple weeks of summer, and we will see you again next time.
Thank you. Bye-bye.